Look at this video of a therapy session. The patient recites their anxieties using all the precise clinical terms, yet their expression is blank and their body is rigid. They are completely emotionally stagnant. In psychology, this is known as proceduralization. Proceduralization is a state where the brain runs a repetitive, highly practiced script without actually absorbing or processing any new information. Now, imagine the exact same scenario, but the therapist interrupts the familiar script. They introduce a slight, highly believable twist to how the patient expects the future to play out. Suddenly, the patient's posture shifts. They take a deeper breath, their eyes widen, and there's a sudden, almost electric feeling in the room. They appear immediately alive. The words spoken in both sessions were nearly identical. We have to figure out what biological mechanism separates the dead loop of the first session from the sudden electric presence of the second. That feeling of sudden presence is the activation of an ancient brain-organizing survival mechanism known as the orienting reflex, and it is being triggered entirely by a shift in conversation. Watch this fast-motion clip. When a twig snaps in a forest, an animal instantly snaps its head toward the sudden disturbance. That immediate physical reaction to an external threat is the classical definition of the orienting reflex. Modern psychophysiology shows this system tracks significance and meaning, evaluating whether a piece of information matters to our survival rather than merely flinching at loud noises. Because the reflex evaluates meaning, humans can trigger it without any external stimulus at all. We can practice orienting inward. Orienting inward is the process of hijacking this ancient survival system using only our mental imagery. For an internal thought to trigger this reflex, it has to meet strict criteria. The imagined future must be emotionally relevant, highly vivid, and critically, it must differ from the person's entrenched expectations of what will happen. Researchers refer to this as schema-incongruent imagery. Schema-incongruent imagery is a specific type of mental simulation that presents an unexpected but believable scenario that contradicts a person's deeply held beliefs. When you vividly picture a credible alternative to your usual anxieties, it acts as a high-priority internal signal. It tricks your nervous system into reacting to a thought exactly as if a physical event were happening in the room. Visualizing a meaningful alternative future actively recruits the brain's most powerful attentional architecture to focus entirely on that new possibility. Looking at this animated diagram of neural connections, we can see exactly what happens when that internal signal hits the brain's processing centers. A new, distinct signal node appears right in the middle of the existing habitual pathways. The system immediately responds by flooding the network with acetylcholine. Acetylcholine is a neuromodulator that rapidly alters how different areas of the brain communicate, increasing plasticity. This chemical flood alters the brain's signal-to-noise ratio. It forcefully dampens the dominant, repetitive pathways of old habits, quieting the background chatter of the mind. With the old habits suppressed, the schema-incongruent image is amplified and isolated. The brain allocates its immediate resources to processing this new, unexpected possibility. Here, in this cross-section diagram, we see the cascade moving downward from the brain into the autonomic nervous system. The signal alters heart rate and respiratory patterns, literally priming the physical body for action readiness. This transformative cascade only functions correctly under specific conditions. The orienting response must remain highly regulated and safe. If the internal image is too threatening or overwhelming, the body abandons the orienting process entirely. It shuts down into a rigid defensive state. On the other hand, if the image is too familiar or predictable, the brain habituates. The system stops paying attention and slips right back into proceduralized autopilot. A true therapeutic breakthrough is a precise, physically regulated reorganization of the nervous system. It requires the mind to operate in an optimal Goldilocks zone of discrepancy and safety. Traditional therapy often operates on the assumption that healing relies primarily on digging up retrospective memories from the past. The orienting reflex points to a different mechanism called prospective organization. Prospective organization is the biological process where the brain heals and adapts by actively preparing for what comes next. By explicitly setting meaningful goals and visualizing specific ideals, we can use the orienting reflex as a deliberate tool for personal growth. This mental rehearsal physically overwrites deeply entrenched expectations of failure or threat. It forces the nervous system to lay down new, adaptive default pathways. When the patient leaves that second electric session, the reorganization manifests physically. Their posture is relaxed, breathing is deep, and movements are purposeful. We adapt when we stop reciting our history and use meaningful future imagery to dynamically reallocate our brain's resources, preparing the body for an entirely new way of living.